Good morning, Mrs. Evans. Hi, I'm Lynn. I'm going to be your nurse today.
Good morning.
Your doctor has ordered a urinary catheter.
Oh, what is that? Why do I need it?
A urinary catheter is a thin tube that's placed in the bladder to drain urine through a tube into a bag. He noted that you were having a difficult time urinating on your own.
Yes, my abdomen feels full, but almost nothing comes out.
Okay, so that's why we're doing this. Are there any more questions? Okay, I'm going to go wash my hands. We do this as a sterile procedure in order to prevent infections. Okay, I'm done. That wasn't so bad, was it? I'm going to use this fastener device to make sure the catheter stays in place. If it should fall off, just let me or the other nurses and team members know.
It wasn't too bad.
Now that you have this catheter, we need to work together to prevent an infection. The longer the catheter stays in, the higher the risk of infection. So please ask us every day if it's still needed. Our goal is to remove it as soon as we can. Please make sure every person who enters your room washes his or her hands. Staff should wash their hands both before and after they handle the catheter. If anyone forgets, please remind us. Also, it is important that the urine drains freely, so please don't tug, pull, or twist the catheter. Make sure that the bag is always below the level of your bladder, even if you're walking or being transported. Please call the nurse to assist you when you get out of bed.
Oh, I've heard of these infections. What if I get one? Can it be treated?
Yes, absolutely. Please let us know if you experience any common symptoms, such as burning or pain in the lower abdomen, fever, bloody urine, burning during urination, or an increase in the frequency of urination after the catheter is removed. If you develop an infection, we will immediately treat it with an antibiotic. Your doctor will determine which antibiotic is best for you.
Wash hands, bag below bladder, watch the tubing. It's a lot to remember.
I know it is, but it's for your own safety. And I already wrote it here on the communication board. Just as a reminder, for your catheter, wash your hands, make sure everybody else washes their hands, bag below the bladder, watch tubing, and call a nurse for assistance. If you have any concerns or questions, just ask me or any of the care staff.
Patients want to be told what will be happening to them. Patients want to know what procedures are for. Sometimes patients are hesitant or nervous about a procedure. Patients need to be educated about how to prevent potential infections and what can be done if they acquire one. Patients are sometimes overwhelmed with instructions and need to feel they can ask questions at any time. This concludes Module 1. Preventing Catheter-Associated Urinary Tract Infections in the Patient's Perspective series of Safety and Care. Patient advocates contributed to the dialogue, highlighting the key takeaways that patients want you as a caregiver to know, as they thank you for practicing safe and compassionate care going forward.